This is video 9 of the full body series of self-release, the basic self-release videos. In video 9 we're going to focus on the TFL. Now we've just, in video 8 we've done the medial glute. Now the TFL basically runs almost right with the medial glute. The medial glute is slightly on the side, the TFL is slightly in the front. The TFL, a very important muscle. Now the TFL and the medial glute, they attach to ITB. So a lot of people that have had knee pain or iliotibial band pain heard about that. It can come because of, it comes because of tight medial glute or TFLs. Now they work with other muscles, like I explained before as well. But in the advanced series, we'll take you through the combinations and that type of thing, and how important it is to release combinations. And then we'll also look at more in-depth videos of specific issues that one has and which combinations to release for those issues. But for this video, we're going to do the Tfl Basic Release. So the TFL sits in front of the body here, right on the pelvis. So what you want to do is you want to grab hold and put your thumb right in the front. If you feel the little point of your pelvis, you can go just like 2 fingers down and you'll feel right in there. That's your TFL. Now a good way to feel it is to kind of like lift your leg and take your knee out to the side, and you'll feel it kind of contracting. That's a great way to feel where it is. Now always remember to stabilize the knee. Bend it a little bit when you've got controlling your body weight. Now in this one, with the glute, we had the toe on the floor and relax the leg. This one, we got the heel on the floor and relaxing the leg. And then what you do is you just a bit of a rotation from medial to lateral. So pull in medially, then push laterally, medial, lateral, which is rotating in and out. And then as you rotate, you got that trigger point right in there. You can do it seated as well. So if you grab a chair, you can sit down, get the leg out like this, nice and relaxed, and then you work in there. It's actually quite an effective way to release the TFL right in there. Then you can actually use a wall as well. Remember, stabilizing legs bent, arm, elbows slightly bent, just to stabilize yourself, and then you can add a little bit more movement because now you've got more balance. And then that's also very, very good, like a knee up with the rotation. It's very, very good to get into that TFL. Then obviously we're going to add the tools. Again, the tools that I'm using with the whole series is going to be a cricket ball, a golf ball, a foam roller, gym towel for the cricket ball to go in so that you don't mark your wall, or if you're afraid you're going to drop it and make some noise, or you don't want to hurt a wooden floor, or various reasons. Some people feel more comfortable with it in a gym towel or in a sock. I like to use that from time to time, but I prefer feeling the ball. I find there's more movement with just the ball against the wall. So that's the way we're going to go with this technique today. So I'm going to release now the opposite side to what I showed with the hand release with the ball, and we're going to go into the wall. Now with the medial glute we were side on. With the TFL we're going to be slightly at an angle. So it's slightly side on, slightly front on, because we've got to get slightly more anterior to the medial glute. So anterior meaning the front of the body, posterior is the back of the body. So we're going to be slightly more anterior to where we were for the medial glute. So it's not quite side on, it's slightly at an angle. Ball against the wall, and then as the ball is against the wall, you're going to lean in with your TFL. Again, if you don't know where it is, put the ball against your TFL, just down from your pelvis, from the point of the pelvis, and then add a bit of that movement, a knee up and taking the knee out to the side. You'll feel where that muscle is. Then while it is against you just go lean against it, and you'll feel right in there. Now what you can do is a little bit of a rotation. Always remember the leg stabilizing, so readjust, hold the ball where you want to keep it, readjust, make sure your leg's comfortable, push into the wall, and then you can add that twist again. And if you want to go a little bit further, you can add a little bit of up and down, and a little bit of movement with the knee, both medial and lateral rotation of the hip, and then up and down, medial, lateral rotation. And then again, similar to what we did with the medial glute, you push the knee out and then relax into it. Push it against the wall and relax into it, and that's a good way to get into that TFL muscle. Very, very good muscle to release with a whole combination of things. It causes a lot of knee, hip issues. It can even cause issues with the feet and lower back issues. So very, very important muscle. And again, when we go into the advanced series, we'll go more in depth on exactly the connections. Hope this works, and thanks for watching.